Okay, I think we'll make a start. So, hello everyone. This is the third webinar in a series of webinars that we are promoting to describe what the Centre for Professional Development for Lifelong Learning can offer to you. This webinar is called A Prescription for Pharmacists. It's going to be delivered by myself, who's Jackie Kinsey. I am the Prescribing Studies Programme Manager, and Wendy Clark, who works across all our programmes, but specifically works on our MSc programmes. This webinar is designed to introduce you to the independent prescribing course for pharmacists through CPD for All at Keele, and more importantly to discuss why I think that the independent prescribing course is in fact a prescription for pharmacists. By the end of this webinar, you should have a greater understanding what CPD for All are and what we do, what the IP qualification will enable you to do. I'll give you some information on how you can gain the award and where you will study and when you can start your studies. But importantly, I shall also discuss whether it's right for you, and I'll finish off with a short case history that describes my role as both an academic and as a prescribing pharmacist. But before we start on that, Wendy is just going to give you a little bit more background information about CPD for All. Over to you, Wendy.
Thank you very much, Jackie. So we'd like to just tell you now a little bit about our centre and how we deliver courses and how we can help you. If you are tweeting during this webinar, then please do the hashtag CPD4All. So the Centre for Professional Development and Lifelong Learning was originally established in 1994 as a department in Keele University, with a unique mission to provide postgraduate education for pharmacists and other health professionals whose role is central to the prescribing and use of medicines. Over the last 20 years, we've built strong links with the NHS and with employers and have a national and international reputation for delivering postgraduate education through distance and work-based learning. The Undergraduate School of Pharmacy at Keele was established in 2005, and we became a centre of excellence within the school. Our growing reputation led to the formal development of the centre and the launch of the Centre for Professional Development and Lifelong Learning, otherwise known as CPD for All. At CPD for All, we've built our reputation on the provision of distance learning courses that support your professional development. All our courses are provided online, meaning you can study wherever and whenever it suits you. We also offer flexibility in what you study and how you choose to approach your course. You can choose to register for a certificate or a diploma award from the outset, or to register for one module at a time and build up credits towards an award. Of course, you don't have to study towards an award. You can choose to study one module with us if that meets your own professional development needs. All of our modules are designed for practicing health professionals and are designed to encourage you to put your learning into practice and reflect on your development. We do this through the use of learning activities within modules, such as practice spotlights and work-related assessments and projects. You'll be asked to keep a reflective portfolio for most of our courses, and this is where you can really demonstrate and reflect on your development. At CPD for All, we have a dedicated postgraduate team with expertise in supporting distance learners. The postgraduate team includes administrative as well as academic support. We provide you with written materials and podcasts to get you started, a dedicated induction programme, guides to IT systems and dedicated IT support. We are always at the end of the phone. Once you get started, we provide detailed feedback on your assessments to help you develop. We receive many comments about the high level of support we provide from both students and external examiners. Very few of our courses contain compulsory elements. We offer the options to choose modules that best suit your learning needs and to build up your own pathway to a postgraduate award to meet your own particular learning needs. The course builder on our new website shows the choice of modules from the different programmes and enables you to start to build up your pathway to an award. The independent prescribing course is slightly different, as it is a fixed programme that has been designed to meet the General Pharmaceutical Council learning outcomes, but it is still offered as a distance learning course with some attendance required at Keele University. I'll now pass over to Jackie to talk to you a bit more detail about our independent prescribing course.
So here we are. This is the definition of independent prescribing that the Department of Health came up with a few years back. What I really want to do here is point out the words that are in bold. So we've got prescribing by a practitioner, which could be doctor, nurse, pharmacist, and now we have got many other healthcare professionals who are also becoming independent prescribers, who are responsible and accountable for the assessment of patients with diagnosed or undiagnosed conditions and for decisions about the clinical management required, including prescribing. So note the words in bolds. We've got responsible and accountable. So if you become an independent prescriber, it is only you who is responsible and accountable for your actions in relation to the management of patients. The definition includes diagnosed or undiagnosed conditions. So there will be times when you will have to make your own diagnosis and not rely on other healthcare professionals. Are you prepared for this, or do you need more training? You'll also be responsible for the decisions about the clinical management of that patient, and that may or may not include prescribing. So I believe that this qualification is very important to pharmacists because it really does give you increased professional responsibility, and that will add to your own professional development and your career, and ultimately increase your own professional satisfaction. This role does come with great responsibility, so it is really important that you are qualified to take on this role, and probably also to make sure that your professional indemnity insurance is up to date and reflects your new role. So moving on, why choose CPD for all at Keele University to study your prescribing course? Our course is a dedicated course for pharmacists, and we believe that does offer a lot of opportunity for pharmacists and that we can tailor it directly to the needs of pharmacists. CPD for All has a track record in prescribing expertise and postgraduate education. Our independent prescribing course in the UK was one of the first to be accredited, and we are very proud that the first pharmacist prescriber in the UK graduated from Keele University. We have been providing the independent prescribing course for over 10 years. We are now teaching our 14th cohort of independent prescribers, and that is built on the experience that we gained from providing supplementary prescribing courses and independent prescribing courses beforehand. Our flexible distance learning format is very convenient to those who are studying and managing a working role at the same time, and you can use our independent prescribing course as a formal academic award which can be used towards the diploma and the MSc. So what does the course at Keele look like? Our course gives you 60 academic level credits, which means that you have to study for the equivalent of 600 hours. About 50 hours of that is provided on face-to-face study days. You are also required, in line with all the other courses in the UK, to spend 12 days of supervised learning and practice with a medical practitioner. The remaining hours you will complete with open and distance learning material, and we will provide you with plenty of resources to help you in this. Our courses normally start in September, but please contact us as we also offer additional courses according to demand. I want to speak a little bit about the DMP role, which is the designated medical practitioner who supports you in your 12 days. Their role is to provide the trainee independent prescriber with opportunities to develop competence in their prescribing, particularly around skills in history taking, diagnosis, use of the clinical equipment in relation to your chosen area of clinical practice, and other competencies relating to prescribing. They will be expected to supervise, support, and provide shadowing opportunities, as well as assess you. You should spend some time identifying who this is for you and discuss this with your prospective DMP before applying for the course. It must be someone who has experience of training and perhaps who has supported other non-medical prescribers before. As part of this role, we will provide a prescribing competency workbook for you to review with your DMP. This will assess your ongoing achievement of the learning outcomes and prescribing competencies as you complete the course. You will also be expected to complete a reflective portfolio, and you will be able to use this to share evidence that you've achieved the learning outcomes and prescribing competencies that are required for this course with your DMP. But why open and distance learning? As I said, there is great flexibility with our course in that you can choose to study at a time and place that suits yourself. We also provide you a lot of content, and some of that may not be relevant to you, as you may already be well experienced in some areas of the independent prescribing course. It also allows the trainee independent prescriber to tailor the course to meet their specific practice needs, and it is compatible with a constructive and reflective approach to current and future practice. Our reflective portfolio is a key component of this course, and it is highly acclaimed by our external examiners. It is key to the student's learning and development. Not only does it provide a vehicle for collection of evidence of achievement, the process helps to develop deeper learning and critical thought. It is conducive with the advanced practitioner status, and it will help you to gain RPS faculty membership. You can also use it to help others to learn. For example, we have many students who say that their designated medical practitioners have learnt from their trainee independent prescribers. So is the course right for you? To be able to apply for the course, you have to be a registered pharmacist with the GPHC or the Pharmaceutical Society of Northern Ireland. You must have at least 2 years of appropriate patient-orientated experience in a UK hospital, community or primary care setting following your pre-registration year. You should have identified an area of clinical practice in which to develop your prescribing skills and have up-to-date clinical, pharmacological and pharmaceutical knowledge relevant to your intended area of prescribing practice. Many pharmacists ask us when they're applying for the course what area they should choose. And I think it's important to choose an area that is a strong clinical area for yourself. Once you have qualified to become a prescriber, you are not restricted to the areas that you can prescribe. It will all be based on your own competence to prescribe in a particular area, and that is down to your own professional responsibility. Another entry requirement is that you will have to demonstrate that you can reflect on your own performance and take responsibility for your own CPD. And as I've already mentioned, an important part of the application is that you have identified somebody who can support you and train you while you are undertaking the course. So before you apply for the course, have a good reflection and think whether it is right for you. Read around the different materials about independent prescribing so that you have a basic understanding of what it all entails. Identify your designated medical practitioner and make sure that you have the full support of your employing organisation. I'll be confident that you will in a position to prescribe in the short term after qualifying. I can't think of anything more frustrating than to have gone through this course and to have qualified as an independent prescriber and then not to be able to identify a role where you can prescribe. Please don't allow yourself to be coerced into doing the course. It is an intensive course and does require you to really dedicate yourself to this training. So don't just view the qualification in terms of your CV, and please be prepared to make some social sacrifices for the next 6 months. Now I'd like to move on to my story as a prescribing pharmacist. So I qualified as a pharmacist non-medical prescriber in 2008 and then started to work in a medical practice in Stoke-on-Trent. I provided 2 sessions a week running predominantly hypertension clinics. I combined this with my academic role at Keele University, where I was and still am the Prescribing Studies Programme Manager within the School of Pharmacy. This dual role allowed me to substantially add to the learning materials for my students and to give them support over the practical issues on becoming a prescribing pharmacist in a primary care setting. The area where I work, Stoke-on-Trent, is an area that has high deprivation with morbidity and mortality rates significantly higher than the English average. There was and still is a local focus on health inequalities, with support for new initiatives which would address this agenda and that would support improvements in patient choice and access. Back in 2008, the practice did not employ any non-medical prescribing nurses or pharmacists. It was felt that by having additional prescribers within the practice, time would be released for the GPs to concentrate on more clinically demanding patients. Previously, for example, if a nurse found a patient with an elevated blood pressure, the patient would either have to wait while the nurse contacted the GP, or would have to come in for a GP review or make a telephone consultation to discuss changes in medication. In my new role as a prescriber, I could do the full workup needed for patients newly diagnosed with raised blood pressure. For example, arrange blood and urine tests, ECGs, etc. And I could initiate and titrate their medication until their blood pressure was an acceptable level, whilst ensuring all appropriate monitoring occurred without having to involve the GP. My post also met many of the national organisation targets with regards to patient access and choice, supporting long-term conditions and bringing financial benefits. Against this background, I was employed by the practice for 2 sessions each week. Partly during extended hours, one of my sessions was run as an evening clinic to run cardiovascular, chronic disease and medication review clinics. I originally gained my competence as a prescriber in the area of hypertension. I enjoyed working in this area but expanded my role within the practice to cover other areas where monitoring of blood pressure was required, for example in stroke patients, women on oral contraceptives and patients with chronic kidney disease. I have also gained competence to prescribe for patients with asthma and COPD and women's health issues, and I also prescribe for minor ailments. I also took an active role in completing medication reviews and renewing repeat medications. I have loved my prescribing role. A greater part is to understand the patient and their views on medication and the treatment of their condition, and to reach a concordant decision about the management of their condition. Every patient comes into the consultation room with a different set of circumstances, and I am often humbled by those who lead very difficult lives. I imagine this is why many doctors choose general practice. For me, becoming a pharmacist prescriber has allowed me to use my pharmacy skills and knowledge to a much higher degree, and has given me a lot of professional satisfaction. I believe my training as a pharmacist allows me to make evidence-based, safe and cost-effective drug choices, but also helps me to talk to patients about their medication and to enable them to become partners in the management of their condition, hopefully leading to better health outcomes. I would encourage all pharmacists who are looking to extend their professional role and who are looking for increased professional satisfaction to work towards becoming a prescribing pharmacist. In my view, it is a prescription for pharmacists to extend themselves. Thank you for listening to my story.
I think we also have a few other webinars that we'll be producing in the next few weeks. Jackie, did you want to just tell us about what those webinars are?
Okay. Yeah, I'll just move on to our next slide. So this slide details the web link where you can get more information about our webinars. So our next one is the Keele's Professional Doctorate in Pharmacy, and that's going to be held on Tuesday evening at 7:30 on the 9th of June. Got another evening webinar on the 18th of June, again at 7:30, and that will discuss Keele's Flexible Clinical Diploma. Our final one in this session is on the 29th of June. Again, it's an evening one. We'll be running at 7:30, and that one will be looking at MUR accreditation. Thanks, Wendy, for reminding me to bring those to everyone's attention.
You're welcome. And if we have any questions, then we'll answer those. Just type those in the chat box. Thank you all very much. The technical difficulties, then please do.
Just wait for this question.
I think Lizzie might be typing something.
I do think it's very important that you identify a medical practitioner who you've got quite a close working relationship with. I think that just really helps to build up the support. That doesn't mean to say that sorry, I'm losing my own train of thought there. That doesn't mean to say that if you haven't worked with somebody before, but you know, it's a doctor who works close to your community pharmacy or is one of the consultants that you work with in your hospital. Um, so really it is best just to, pick up the courage and ask for some support. A lot of medical practitioners are quite used to supporting nurses through their medical prescribing, so you will find that quite a lot of them are familiar with this role. Where we can help you is that the General Pharmaceutical Council also allow you to spend a couple of days of that 12 days learning and practice with a prescribing buddy. Now this must be an independent, for a pharmacist, it must be a pharmacist independent prescriber. It can't be a nurse independent prescriber. And we do have a list of our past students who are willing to act as mentors or as buddies for people who are undergoing the course currently. But again, I still think there's a lot of benefit from trying to find your own prescribing buddy as well. Any other questions?
Well, I think, in between times, Lizzie,
I think when I've talked to people who work in CCGs and maybe already be working as practice pharmacists or similar role, is quite often the CCG will support the practice by giving additional time when the pharmacist is qualified. If a medical practitioner is willing to support them, then they get a bit. So it's a bit sort of quid pro quo. But again, that's down to individual organisations to organise that. How many hours of study do you think are required is a second question that's coming up. Well, the course does count as 60 academic credits, which does equate to 600 hours of study over the 6 months. So you are looking at doing 20 to 25 hours a week, so it is quite an intensive course.
Lizzie's just typing again now. Just wait for that to come through.
Right, Lizzie, you're asking how many times you come to Keele. I don't think I did cover that, sorry. We run 6 study days during our 6-month programme, and normally it's 1 Wednesday a month. And that includes your assessment days as well.
If I can just add to that, also within our CPD for All website, all the dates for the September intake for the independent prescribing course, Jackie's put all the dates up there already for the study days, so they can get planned well in advance.
That's correct, Lizzie.
In terms of your diary commitments.
Just see if there's any more questions coming through. If not, I'll put up the final slide. In fact, I'll put that up now. We can see if any more questions come through while I'm doing that. We are continuing our series of webinars, and you can find more details of those from the website on this slide. Our next one will be about Keele's professional doctorate in pharmacy, and that is Tuesday the 9th of June at 7:30, so that's an evening one. On the 18th of June, there's a webinar about our flexible clinical diploma. That's also starting at 7:30 p.m. And the final one that we've got planned at the moment is on the 29th of June, and that's about MUR accreditation, and that's also at 7:30. Yes, Lizzie, I don't know whether you lost sound at that point. I did cover that. When you, as part of the course, we do ask you to focus on one clinical area, but once you're qualified, you can prescribe in any area that you feel competent to. So, for example, if you focused on diabetes for your course, then you could be prescribing in hypertension, asthma, or anything else. But it is completely down to you to provide evidence or have evidence that if anybody questions your competence, that you can prove that you are competent to prescribe in that area. And we hope that the reflective portfolio that you complete as part of this course can be used as a model as you go into other areas.
So yes, thank you. I think that's been really useful to have that sort of chat about drawing out different aspects there from the independent prescribing course. And as Jackie
Any
said,
final
we've now had
questions?
14 cohorts, was it, Jackie, through the programme?
Okay, so I don't think we're going to have any more questions. So thank you very much, everybody, for attending today. And I say, if anybody know of anybody who's wasn't able to make it today but would like to hear about this webinar, then it has been recorded. And again, you can access the webinar from the website on this slide. Thank you and goodbye.